Hello and welcome back to the MKM Healthcare Infection Control Training, Part 6, Dealing with Spillages. It is important when you deal with any spillages that they are dealt with immediately and effectively, as they are likely to contain pathogens. Blood and blood-stained body fluid spillages may expose you to blood-borne viruses and other pathogens. It is also therefore essential that you ensure that you are using personal protective equipment, which may include apron, gloves and goggles, and that you are up to date with your hepatitis B immunisations. To deal with spillages, you can use chlorine-releasing agents. These have been proven to be the best choice when dealing with blood or blood-stained fluids on a hard surface. You can use chlorine-releasing agents such as hypochlorite, and they come in the form of granules, liquids and tablets. When preparing the chlorine-releasing agents, it is important to remember the following. As there is a risk of splashes to the body and eyes, you need to consider what personal protective equipment you need to wear. If there is a risk of splashing, then you must wear goggles. Should you get any splashes into the eye, immediately wash the eye with cold running water. Chlorine-releasing agents must never be mixed with hot water or any other cleaning agents. And chlorine agents must not be placed directly onto urine, as they can create toxic fumes. If you have any solution remaining after you have dealt with your spillage, this solution must be discarded of immediately. The concentration for your chlorine solution is as follows. If you are using it for decontamination of spillages or body fluids, then you need to make up a strength of 1%. If you are using it to disinfect items or surfaces that have been contaminated with blood or body fluids, then you need to make up a strength of 0.1%. Chlorine-releasing preparations come in a variety of forms, and this includes tablets, solutions and also granules. The following table advises you of how you should make up the quantities if you are having to make these up. If you are using the granules can be placed directly onto the spillage. You then leave it for 2 minutes. After 2 minutes, the granules will have soaked up all of the spillage, and you collect it using the scoops, dispose of it as clinical waste, and then wipe the area with water and general detergent. You can purchase spillage kits that contain all of the things that are required to deal with any spillages. When dealing with any spillages, make sure that the area is safe for your staff, patients and the public. Dispose of any personal protective equipment that was used as clinical waste. Ensure the area is well ventilated. Ensure the area has been dried thoroughly to prevent any slips and falls. Remember, after you have removed your personal protective equipment, to wash and dry your hands. In some incidents, it may be necessary to report the incident. If you have had a spillage where there have been glass particles contained, then you should remove the glass particles using forceps, and these glass particles should be placed into a sharps container. If you have a blood spillage, then cover the spill with your chlorine-releasing granules or hypochlorite solution. If you have a spillage of urine, wash the area with hot water and general purpose detergent. If there is any blood stain, take care when using any chlorine-releasing agents. If you are to get any spillages onto your clothing, sponge off with hot soapy water as soon as you can. When you get home, it is important to wash the garment in the hottest temperature the garment will stand, ideally at 60 degrees or above. If you get a spillage onto any upholstery or carpeted areas, mop up the excess with some kitchen roll, sponge with cold water, and then clean it with hot water and a general purpose detergent.